And welcome back once again to the Ask Dr. Mather Show alongside Dr. Brian Mather with the Spokane Chiropractic and Sports Injury Clinic. Today we're talking about soft tissue work, specifically active release technique, commonly known to a lot of the Ironman triathletes of the world as ART. For other people who haven't heard of it before, Dr. Brian, what is ART?
ART, or what's known as active release technique, is a soft tissue technique. So you could say it's like a type of massage, but it's massage on steroids, if you will. I believe it to be probably the top soft tissue technique that's in manual therapy. It was originated by a chiropractor, Dr. Mike Leahy, and so you see it a lot in the chiropractic world. However, you're starting to see more massage therapists go and train in ART. So we have an ART provider in our office. His name's Chris Gradeville, and Chris does a phenomenal job at working with not only our everyday patients, but our athletic patient populations. ART is really designed to address the cumulative trauma disorder. So when patients have repetitive motion issues, they develop scar tissue in the musculotendinous junction. So the point at which a muscle starts to become a tendon, and then that tendon goes on and attaches to a bone, you develop scar tissue or fibrosis in those areas, and that muscle can't function correctly. And so ART really gets in there and breaks up that scar tissue and remodels the tissue. So what we have found, and I've been working with ART practitioners for 20 years, and what I've found with ART is it enhances my ability to heal patients. When we get the soft tissue components worked out and I can address the joint issues and they address the soft tissue piece, patients heal so much faster and they stay feeling better so much longer, which is why you see ART partner with Ironman and they have a tent at every event. Because when you go through the rigors of training for an Ironman event, your body is pretty much toast when you're done, and those tissues, that cumulative trauma from all that training and that racing, they have to get worked out so that you can heal properly and get ready to train for your next event. And so it's a phenomenal technique, and I would encourage wherever you are in the United States, if you have soft tissue problems, get on ART's website and you can find a provider somewhere in your area and seek them out. They go through an extensive amount of training in order to provide the technique at a very, very high level. And I would stick with practitioners that are certified. There's a lot of people, it's an expensive technique, so sometimes you'll see people that say they do ART, but the ones that are constantly going and getting recertified, they're better than anyone else that we come across as far as soft tissue work goes.
What are some of the conditions ART is most effective at treating?
One of the top ones is carpal tunnel syndrome. If you have an issue with your elbows, they call it tennis elbow. It's really lateral epicondylitis, but pain at the elbow and the forearms and hands, shoulders. We do a ton of shoulder work in our clinic, and so often we have dysfunction of the rotator cuff muscles to get in and break the scar tissue up that develops in the overuse in the shoulders. It works phenomenally well. If you have what's called a peripheral nerve entrapment, ART does wonders at allowing the nerves to floss through the muscles like they're supposed to. You can tether a nerve in a muscle, especially like in a hamstring or in a calf muscle, and it can create all kinds of problems. So ART really is full body. They have techniques throughout the entire body, but those are some of the common ones that we see it really make a huge impact with in our clinic.
Also like headaches, shin splints. Talk to me about headaches, because people always talk, hey, I got a rough day, I'm coming home, my head is just pounding. Is that related to it? Is that something that could help it?
Absolutely. A lot of headaches that we see are what we call cervicogenic headaches. They're generated from your cervical spine, from the joints not functioning correctly in your neck to the muscles that come up through the trapezius and attach in the back of the head. And a lot of that tension in your head, those tension headaches as well, they are related from joint and muscle problems. And so by addressing those joint and muscle problems, restoring proper function to the joint mechanics and to the soft tissues, you can see tremendous relief of headaches. It always surprises me the number of patients that come into the clinic and you ask them if they get headaches and they'll say yes, and you say how often, and they go, daily? Like it's a normal part of daily life. I'm here to tell you folks, it's not. You shouldn't be having headaches every single day of your life. You shouldn't have headaches 3 or 4 days a week. There's usually things that can be done to try to help people so that they're not suffering chronically from headaches. And while there's many, many causes to headaches, cervicogenic or tension headaches are just one type of headache, but chiropractic and massage therapy are very effective ways at addressing those types of headaches.
Is it too simple to think that an aspirin is the solution?
An aspirin is like anything else. It's a Band-Aid. It's taking away the symptoms, but it's not addressing the root problem, which is why you're probably getting them frequently, because you're not really addressing the root cause of the issue.
Active release technique, very educational. Thank you, Dr. Brian Mather with the Spokane Chiropractic and Sports Injury Clinic. If you have a question for Dr. Mather, use the hashtag AskDrMather on Twitter, Facebook, or YouTube. Thanks, Brian.